everyone. Walt Shomorn, Director of Digital Media at ScienceBoard.net, and I'm very pleased to be here with Dr. David Smith, VP Technical Operations at Ori Biotech. David, welcome. Thanks for joining us.
Thanks for having me. It's great to be here.
Really appreciate it. I'm just going to jump right into it. Where do you see, from the Ori Biotech perspective, current challenges of cell and gene therapy manufacturing in general?
Yeah, that's a loaded question.
I know, it's kind of a...
where to begin and where to end on that. I think, the industry is moving at such a rapid pace, and I think, there's a real challenge, to keep up with that pace. And I think, there's so many facets of manufacturing that all have to come together in order for it to be successful. So, you look on one hand, and there's sort of, once you look at the commercial reimbursement and you start bringing in cost, you've got quality concerns all throughout that. You've got personnel worries around how you're going to manufacture this moving forward. And so I think, the way that Ori's looked at that is, can we take a holistic view of manufacturing, the full spectrum of everything, and really whittle down to where are the crucial areas that we need to solve today and also moving forward into the future. And there's kind of two different kind of visions of which you need, but for the majority of the products, it's kind of taking that full life cycle approach. The problem that you have today isn't necessarily the one you're going to have in 5 years, but you need to be planning for it. And so having that holistic approach to go kind of all the way through the life cycle is crucial here.
You guys are, you guys, from my perspective, from looking at Ori, you guys look at fully automating and standardizing CGT manufacturing. You talk about manufacturing challenges, and I think it was Elon Musk who was like, production's a bitch when somebody was talking about, Model 3s or whatever it was. How do you guys look at it? You're fully automating and standardizing CGT manufacturing. You talked a little bit from the complexities of it, but how are you guys addressing that?
Yeah, and I think there's, as we look at kind of the complexity, the inherent complexity, what we see in the market and what's needed is flexibility.
Yes.
And generally, flexibility and automation don't really play well together. And so I think that's kind of the real challenge that we're trying to solve, is that people want to be able to play, adapt, change, based on their learnings. And so, as you do a lot in PD work, in the process development, and then you take it into manufacturing, that first time you see a patient and a disease, you're going to see something completely different. And so you need that flexible approach in order to sort of overcome a lot of the challenges. And so, but I think not just kind of the unit op flexibility in terms of parameters, but the whole process.
Yeah.
I think there's a number of products that are out there that have multiple manufacturing trains in order to get a final product that's actually going to be viable, efficacious and things. So I think when we look at sort of, again, that end-to-end holistic, how do we reduce the cost? How do we standardize processes? How do we provide a solution into the market that can help people think that way? Right. And it hasn't been thought that way. No one's thinking that way. Right now it's as fast as we can go, get into the clinic, get into the human patient, and treat as many patients as possible. And that's what we're really about. But we're failing at that. If you actually look at the number of patients we're managing to treat, we're failing at that. And so we need platforms that enable standardization, that enable closing the system with those things, automating it to reduce the labor cost, to reduce the clean room cost, all of those things. And it's not just one solution, it's bringing that all together. And actually from Ori, it's putting a digital platform above that. And I think that's one of the crucial, for us, really changing the scene of things, is how do we bring in the manufacturing complexity and overlay a digital infrastructure that allows you to learn. Everything right now is written down on paper. No one's looking back at the paper. It's an N of one. You're reacting to what you're seeing on the fly, and you're changing things constantly. If we put together all of the CAR T runs that have been done, and I think, as mentioned, there's sort of over 10,000 probably if we look at them. If we look at all of that data and put it together, there's so many insights that we can have from that. And that's something that we're trying to say, that we can collect all this data during the manufacturing, store that in a cloud, constantly analyze, get insights, and constantly update that database. It's just a very different way of thinking. The data's there, we just don't have access to it.
Yeah, and that's always been, the complexity of data and how to efficiently store it, how to analyze it, how to make it, and I know from the Ori perspective, you guys recently did in Series B funding, you guys recently raised over 100 million or so, and for your platform for cell and gene manufacturing. And I know that the end result of that is going to go into, full commercialization and all other aspects of it. But I was wondering if you could speak to that a little bit more.
Yeah, and it really enables us to get to that end goal of commercializing the products.
Yeah.
And I think, the Series A kind of got us that proof of concept. We got an early alpha prototype out with some of our partners to get a lot of the learnings that we needed to get. The Series B 100 million that brought in said we can now take that. We've now proven out that there's a need. The clients and partners we're working with see that need, and really now putting that quality system behind it, ensuring that we have a robust supply chain. So we're not going to go to market and suddenly be hit with an order that we can't fulfill and cause failures within the therapeutic companies. So it's really looking forward to that commercialization and taking it a bit beyond. I think that you're not going to change the industry with just one product.
Right.
And so that Series B really allows us to take it to the next level and the next level and the next level and start realizing the journey that we're going to take with our partners to fulfill the commercialization, not only of our own products, but also of theirs as well. And so, it's a scary, risk-based decision that therapeutics take to, work with maybe a smaller company, right?
Right.
So suddenly having that capital to say, we're here to stay, we've got a vision, we want you to join us on this journey, and now we've got the capital behind us to enable us to go all the way. I think it's crucial there.
Yeah, I think it's, it's a very, as you mentioned previously, it's a very fast, but it's a very exciting time. It's a very collaborative time, a lot of partnerships happening. It's really interesting when, I was speaking to somebody earlier and, their partnership was already in place, but it's the first time they've actually met each other in person,
Yeah.
Everything's been, all details have gone through, computer screen, Zoom and everything. So, but yeah, from that aspect of things, to be able to have that funding in place, to be able to then scale up and to be able to then do the full commercialization that you see is pretty exciting. So something I wanted to bring in from this side of, we were recently in Europe for a cell and gene conference as well, and now we're here for ISCT, and we start getting more of the flavor for things that are here stateside. And in April, the FDA released guidance to assist the industry in the development of CAR T-cell products. And from your perspective, I was just wondering, are you looking at, do you recommend manufacturing of CAR T therapies at a single site or multiple sites?
Yeah, it's a great question, and actually I think there's room for both.
Yeah, okay.
So I think, firstly that guidance from the FDA I think is a leap forward, right? I think it's really, we see there's issues in the manufacturing that we've spoken about, and I think the regulators see that, and they want to work with us.
Yeah.
I think it's a real sort of change that maybe, previously hasn't been there, that the regulators want to help us. They've seen how great these therapeutics can be, and what can they do? And so that document really sort of starts to bring that to life. And the fact that even within that guidance, there is talk of this centralized, decentralized model and starting to sort of open up there. We've got relationships and with some partnerships to really enable both of those. I think there's going to be room for both. There's benefits to both. And there's, like you say, the industry's moving so fast, and we have to be able to pivot. We have to be able to see what's going on. And Penn released the paper recently of a 24-hour process. Right now, that's starting to enable this decentralized a lot more. If you're looking at a 16, 20-day process, maybe decentralized as a way, there's still a number of challenges we have to overcome. When you start looking at QC, you start looking at control of the manufacturing process. It's hard in one location. It's really hard in two locations. If you're now really decentralizing and maybe putting them at academic medical centers around the world, it's a struggle. And I think there's a role to play again with the digital piece that we spoke about, the automation piece, the removing the human decision-making piece to really show the control and the robustness that we can have in the manufacturing process.
Yeah, I think it's going to be very interesting to see. I was about to say in the next several years, but even in the next, few months, 12 months or so, the FDA and how they work on cell and gene therapies and their approvals and processes and things like that. But I wanted to say once again, thank you so much for sitting down with us, David. I really appreciate it. Exciting things going on over at Ori. So much more to come, and we really appreciate you sharing the content with us, with our audience at scienceboard.net. So thank you again.
Perfect, thank you. Thanks for having me. It's great.
Of course. Take care, guys. We'll see you soon.